Dental Nachos audience, thanks for being with us for our COVID-19 update. We're going to do this every day at 3:30 p.m. Eastern. It's for all of us. It helps me to share, to care, ask tough questions. Stick with our theme, as I've showed you guys before. We talked about yesterday that safety is more important than JBN. JBN is for we have an awesome guest here who loves root canals. He's got gutta-perch in his pocket right now. But safety, JBN is if we're passionately talking about root canal versus implants. This is about safety for us. JBR, JB real. We have to keep this real. It doesn't mean that we have to be overwhelmingly negative or positive. We're going to talk about that today. Just as I was getting ready for this Facebook Live, Mrs. Nacho, she loves his name, just got a message from Philadelphia. They're putting even tighter restrictions on us in Philadelphia. That has nothing to do with dentistry, guys. So we're going to talk a lot about how does this affect us as dentists. But remember, before we were dentists, we were people. We were regular people and human beings. How does this affect us? Because they put some even tighter restrictions on us in here in Philadelphia. So this is about updates. This is about you guys asking questions. I have the awesome Amanda, Director of Operations here. So you can put questions in the Zoom chat. You can put questions in the Facebook Live. But I want to start off this with something we haven't done before, a special guest. I want to introduce you to my friend, Dr. Bret Gilbert, awesome endodontist. He wakes up at 4 a.m. in the morning. He meditates at 5 a.m. He meditates. I want to turn it over to him to just share who he is, what he does, and he has some advice and tips, not only just for finding MB2, he has those too, but also how we can get through this challenging time. Before you go on though, Bret, everyone had one important question yesterday. How many Nacho t-shirts do I own? So I'm on the orange one. And Amanda, maybe we'll have a prize or we'll have a sale. You can get your own cutoff one, working out for more nachos, with the sleeves already cut off if you'd like. So I'm going to turn it over to you, Bret. Thanks for being here with our Nacho audience and share with us some of your thoughts about what's going on here.
Yeah, thanks, Paul. And hello, all the Nachos out there. I'm honored to be with you again. Paul, I want to acknowledge you for the leadership role you've stepped into over this past week and trying to get accurate information to dentists. It's obviously a very, very difficult time, unprecedented, and just want to acknowledge you for all the work you've done to spread the word. So, you know, I want to just share with you just one perspective. And I think what's important in this time, with so much information floating around, with so much panic, with dentists so used to being there, using the magic of their hands and their handpiece to help people, we all find ourselves on the bench. And with that, we find no income coming in. We find the rent bill still due. We find staff trying to ask us, what am I going to do? And it's very, very stressful. And what I wanted, sort of my message today is that everyone has a different point of view. And in the same way that we practice, everyone practices differently. Everyone's going to handle this situation differently. Something that my wife and I have been talking a lot about is really finding a depth of grace for others right now, because everyone processes things differently. This is very, very traumatic. This is very sudden. This is a complete departure from the normal things that we hold on to in our life. And so one person is going to accept this very slowly, another person very quickly. Yeah. One person's going to disbelieve, another's going to be a believer. So I think we need to, just like with Just Be Nice, I think we just need to give grace right now. Maybe can we make a new acronym for that?
Yeah.
Okay. Just give grace. Just give grace. JGG.
I love what you're sharing here, and I want to Nacho-fy it a bit for people listening to me, and even I'll share some personal things with me. So first of all, right now we have established that using a rubber dam for endo is the standard of care. So what I think you're talking about, and you can modify it, but what I'm trying to get across I'm trying to do my part to share, this is a good way to act now. Let's be safe. Let's figure out a way to shorten this as much as possible. But we wouldn't tell someone who doesn't use a rubber dam, oh, you don't have to use a rubber dam. We'd say, use a rubber dam. It's okay if you use a 4 Gates Glidden burr, a 6 Gates Glidden burr. If Bret rose up a little bit there, I'll wait for, oh, you're back. Perfect, Bret. I don't know if you could hear me, but I was saying, I just want to create the foundation of let's give grace while being safe. Let's give grace while being safe. Let's give grace. And if you want to open with this burr instead of that burr, but everyone's going to use a rubber dam. Now, rubber dam is tried and true for years. And one of the things I think dentists are having a really hard time with, Bret, and I'd like you to help, and as an endodontist, I think your brain is tuned into this. They want the studies. They want the studies of the studies of the studies of the studies. But right now we're in this movie together and the information is changing daily. So I think something that we're thinking today is going to change. Have you found that to be something? I found it personally a challenge for me. Have you found that to be a challenge?
Yeah, well, I think what's clear is that we honestly don't have much information.
Right.
I just read an interesting article, without testing, we have no idea what this is.
Right.
So everything that's happening right now might be a complete overreaction. We don't even know exactly what the death rates are because of the testing. So I think we just all have to be patient. I think we all have to do our part to follow instructions. And what we're finding is that as the days turn in, a morning turns into an evening, it's becoming clearer and clearer that we're pretty much heading toward a total shutdown in the US. And this is happening in Chicago, much like Philly, much like California. So we're trying to manage dental patients, but in reality, a normal function of a dental office simply shouldn't be happening right now.
I shared, someone asked me the other day, because one of the challenging parts, and I hope Nachos has helped as much as we can, is to share information with you out there. And someone said, if your daughter's tooth was sensitive tomorrow, wouldn't you want to bring her to a dental office? I said, no, I'd have her wait, because right now we have such a critical time to stop this spread. And we were talking before we went on. I hear you, dentist. I'm in the same way. We have 2 practices. This is scary. It's concerning. I feel this way. But right now, it's been 7 days that we've been dealing with this, not 7 months yet. So let's take this day by day. You've been a big proponent of meditation, Bret. What are some of the ways that dentists could deal with this personally as they are sitting with their thoughts more than we ever have? So the Nacho crew here, I see, stay up to date with COVID updates. Great. Amanda, any questions behind so far? Because I have some to read from.
Somebody asked, is the ADA fighting for us dentists to be included in congressional help?
Good question. To my knowledge, yes, but I'm here. I don't know if my friend Joe Latinelli was able to jump on or not, but he just texted me. He said, Paul, he calls me Paulie, who do we know at the ADA to ask about this? So I think there's only one thing to focus on. The relief package, incredibly important, but more important is for us to be kindly annoying and share how are we going to get our offices open safely. If we're all shut down now, how are we going to make our patients feel safe and be safe? How are we going to make our employees be safe and feel safe? How are we going to make ourselves be safe and feel safe? So the PPE scenario with the OSHA, the CDC, I don't have all these answers. Perhaps you have to Google and go on the website and send emails to info@cdc.gov. But I think it's very important that we are loud as dentists to say we're a critical part of the economy and the healthcare system, and we have to be able to open up safely. Right now, they're talking about if this virus is transmitted through aerosol, how deadly is that? How dangerous is that? If somebody's in one room getting a cleaning and the next person comes in, a 20-year-old, can they pass to a 70-year-old? They're not going to allow us to open up safely until this is answered. And right now they do have a crisis. Mrs. Nacho, I'll speak for her. She might pop on later. We're doing PPE drives in Philadelphia and around here. To me, it's not so nuts that our country is sending people to battle a virus and we are not giving them the right weapons to protect themselves, not even weapons to protect themselves. So those are some of the things that we're doing. But the key, if you're watching and listening, I encourage you, you can do something. You don't have to feel helpless. Reach out to the ADA, the CDC, and OSHA and ask about what is the plan, what is the strategy to get regulations for us to reopen. Right now, the world that we lived in with our ocean PPE is over and a new world is going to begin. And what is this new world going to look like? I don't know. We can't guess. We can't say it's fine with level 3 masks. We can't say we're all going to wear N95 masks. One of the things about N95 masks, they're totally impractical for dentistry. I've worn one. They're for me to walk into a hospital room, seeing someone with active tuberculosis. I dealt with this as a resident. It's not a solution for all of us to deal with going back to dentistry. Bret, are you back and okay?
I'm back.
Okay, cool.
And I think it's going to lead to a lot of wonderful opportunities for creation and for reinvention. And the next generation of dentistry is going to start right when we come out of this, because just like you said, the PPE, the way we handle aerosols, even ways that maybe we can collect those aerosols as they're being produced, all of this will change. And rightly so, because this is just one virus. We're going to be faced with others. This is going to be a complete wake-up call. And the reality is for right now, though, I think it's a great opportunity. We're in our houses, we're with our families. This is a great time to be present. All these things that Paul's mentioning are important, but these will come later. Right now, it's about managing the fact that we're likely to be in our houses for a week, 2 weeks, a month, 2 months, whatever. So how can we get present? How can we take the edge off and just say, it is what it is? The worrying won't help. The prognostication won't help. So what type of habits can we get into? Paul, I'm leading into this because in just less than an hour, 45 minutes, I'm going to be hosting a free webinar with a wonderful expert. Yeah. So what it is right now we're all in our sympathetic nervous systems. It's fight or flight. It's panic. It's grief. It's worry. And what she wants to help us do in this workshop, just an hour, is activate your parasympathetics. That's your rest, relax, digest, and breathe. So she did it for me on Friday when I was having my most difficult personal day with this whole scenario, and I felt amazing. So I put the link up in the chat here. So anyone that wants to join,
let's put that in Dental Nacho's Facebook Live too, Amanda, and then we'll schedule this to go out because people should join in that. And what maybe you can help me, right? Because last night when we found out that New Jersey is now closed down for dental elective care April 20th, I'll share and I'll be real with our audience, with you, because we're all in this together. I've had some very challenging personal situations where an acute event has happened. Sometimes I'm the only one who's known about it, and then I have to report this life-changing information that sucks to a lot of people. But my brain says, this has happened. The towers are on fire. This has happened. Someone that you care very deeply about is no longer alive. This has happened. And we talk about gaslighting, and this whole thing is gaslighting us because it feels like nothing has happened. And to me, that's the most challenging part. And I believe I've been talking with the ADA and doing these things, and maybe I'm on this informational front line. But even for me, I still look outside and I still say nothing's changed. So that must be, that meditation exercise is going to help because we can't even point to this thing that's happened.
Right. And I encourage everyone, I invite you and your families, whoever's in your household, to take part. I did it on Friday. It's really wonderful. And it's tools that you can use through this process. But to me, Paul, it's a simple thing. The more you watch, the more you listen, it's clear that there's asymptomatic carriers. That means that we're all shedding virus everywhere. So we just have to stay home. The dental emergency part is a big issue right now, especially in the endodontic field, because endodontists, of course, want to step up. We want to be the heroes. We want to save. We want to prevent overflow of emergencies into the emergency room. But at the same time, as you just said, we're going into it without a ton of knowledge about.
And you guys are on the. And I want to just drill into what you said there, pun intended. I was a hospital resident for 3 years. We would go in and there'd be 50 people waiting for emergencies. Nothing to do with COVID. So I developed a system. Do you have problems breathing? Do you have problems swallowing? Is your face swollen? No. You're not a true emergency. Now you could be urgent. You could be in pain. You could have an intraoral swelling. How do you determine urgency to emergent? But I encourage my dental people out there to go back to some of your foundations or ask. A chipped tooth is not an emergency. These things are someone with a denture store. People can keep their denture out for a week. First of all, we all do this. You do this with teeth, Bret. This in regular life. My root canal is very sensitive. Everything's fine. Test it out for a week and let me know how it goes. And then a week later, it's fine. We need to use that. I'd be happy to talk with ERs and just share, because this fear of overriding the ER we can't use that fear and then everyone go running into their office back and forth all the time because we're not gonna socially distance at all. So it's tough. I've been triaging on the phone with my brother, but I would say, Bret, and I'm just really saying this out loud, is there a way for oral surgeons and endodontists to maybe create some sort of system in their communities where one person's open one day, one person's not, and get you guys the right PPE?
Yeah, no, that's probably where we're headed. It's some type of organization or center point clinics. I know in Chicago, they're setting up the dental school in that same way, as to be overflow from the main university hospitals in the city. But the reality is, it's just like you said, the California Dental Association sort of led the charge over the last couple of days, coming out and saying, I froze up again, didn't I?
That's okay. You're good.
Okay. About, really from what the first list was early last week to now, which is now life-threatening dental emergencies. And so it's an evolution. But again, back to where I started, Paul, and as much as we want to say is we all do simply have to give each other grace because there's so much at stake here. Some people don't believe it's as big a problem as it might be, but the reality is let's just accept that everyone's going to sort of fall into line in their own way at their own time. And we're all dealing with so many different things in our lives leading up to this. So I think, like I said, JGG, just give grace is probably a good way to follow.
Brett, and we can still hear you in this. So I will shift as we'll wrap up with you a second, Brett, when you're back in. I can see my Nacho COVID update is awesome. I want to make sure you're cool for your meditation seminar. Can you hear me okay? Because I can hear.
Yeah, perfect.
I can hear you. Your face was frozen. So give us some parting Brett thoughts. And then Dental Nachos, I got a whole list of some stuff we're going to go over, strategies. And Brett, you can hang around the background if you want, but I'll let you get ready for your seminar.
Sure.
Give us some Brett thoughts.
My advice is it's three things. Wash your hands as much as you can. Drink hot coffee, hot tea as much as you can. They say it can live in your throat for 3 days. You want to wash it down into the digestive system. It is very sensitive to heat. And last thing, every time you can think of it, take 3 deep breaths.
I like that.
Deep breathing is going to be your answer. It's going to activate your parasympathetics. It's going to let you relax. We have to take control of ourselves internally as leaders so that we can be leaders in our household, to our kids and our spouses, and we can be leaders to our dental team. So commend you, Paul. I appreciate you. I'm so glad that we're friends. I'm proud of you, and I'm here for you if you need anything.
We appreciate all the resources. I love JGG. Share what you're doing. I'll let you jump off. Amanda, just bring me up to the front of the screen, and thanks so much, Brett.
Take care. Bye, everyone.
All right, so Amanda, any other questions while we were gone there?
Somebody asked if they only have 3 boxes of if they have a couple boxes of level 3 masks and no face shields, what do they do if they need to see a patient?
It's an outstanding question. And I sit here before you and say, I don't know what the best answer is. I think we have to really continue to connect with the ADA, OSHA, CDC, continue to ask on Facebook groups. One of the challenges that we have here is we obviously can say to someone, have you been traveling, test for them for a fever, but they can be carriers prior to this. I think the key point is too, guys, and I want us to have a realistic look at this. And I'm not an epidemiologist. I'm a person just like you guys. I am a doctor of nachos, so I'll brag about that. But besides that, I'm a person just like you. And obviously, the hand washing, like Brett said, someone was to touch you and was infected, and you wash your hands. That's going to help prevent transmission. Not touching your face, as people talk about. But in the dental operatory, what are we doing? Like drilling, adjusting sometimes that denture. Cavitrons, cleaning teeth should be totally out. I think you're going to have to take it on a case-by-case basis. And I don't even want to give a yes or no answer on that. I'm trying my best. I think every day matters so much not to stop this spread that if you just get people a few more days, you can reevaluate their dental problems. With the caveat, I want to be a responsible person and dentist that I'm sharing my strategy is, do you have a problem breathing? If they say yes, huge issue. Do you have a problem swallowing? Yes, huge issue. Do you have a facial swelling? Issue. But remember, guys, are you equipped to do that in your offices on a daily basis? It's really an oral surgery and endo thing. If you haven't accessed a tooth in 5 years, I don't think you want to run in there like Endo Robin Hood and perforate the tooth. So you're going to have to rely on your specialist. I encourage you, like my brother and I have, call up the specialist near you, have a conversation, ask them what they're doing, ask them if they're there to help. This is such uncharted territories for dentistry, really humanity for dentistry, where we don't know how to deal with this. And the emergency rooms at level 1 trauma centers like Albert Einstein in Philadelphia are set up to deal with dental emergencies. I'm not totally sure what they're doing there right now in the COVID crisis, but that's what we had done at that time. So I think we're going to have to get our proverbial acts together, but triage is key. Is it emergent, urgent, chronic? Emergent, urgent, chronic. And you have to talk about this with your patients. One thing I'm speculating about, I'm not a dental focused attorney. I'm not giving legal advice. I'm not giving even clinical advice. I'm sharing what I do and I'm sharing my thoughts. One of the things that I'm thinking about, if your patient comes in with an emergency and then they get the COVID afterwards, whether they got it in your office or not, is there a liability? Maybe yes, maybe no. Do we have a sign them form? Do we not have them sign a form? I just want to bring up at this time, I've gotten so many great messages and questions. I was just thinking about this form thing. If I haven't gotten back to you, please re-email it to salsa@dentalnachos.com. any Facebook message, Instagram message, text message, email that Paul Goodman, Dr. Nacho, has not gotten back to you on, it's just because I have hundreds right now, and salsa@dentalnachos.com is our bucket for all of this. What I want to move on to next is some of the questions that we had from the past on my Nacho clipboard here. 1099 versus W-2, getting a lot of questions about, can a 1099 apply for unemployment? It's a question for your accountant. Up until this point, dentists have sometimes been easygoing about saying, oh, it's no big deal if you're a 1099. But now if you're an associate dentist and you're applying for unemployment and you're not a W-2, that can be a problem. I'm sharing. Our associate general dentists are all W-2 employees. Can you justify not being a W-2 and being a 1099 in the midst of this crisis? What do you do? That's one of the questions that I've been getting frequently. Amanda, a few more things here. Any other questions that you have on your end right now?
Somebody asked if it's going to be necessary to use air filtration units once you start practicing again.
I think that that's totally possible, but the CDC and OSHA is going to tell us. I don't know enough, but it's all about how to, and here's the thing, guys, you could be sitting there feeling helpless, feeling worried, feeling concerned. I am too. Take deep breaths and move past that and say, what's one small thing? The theme of this week, safety, continue to stay at home, stop the spread, be a hero in your sweatpants. By the time this is over, I'm going to need larger sweatpants, eating a lot of Cheetos. I don't know why. Now, safety, strategy, and small solutions. So safety, strategy, and small solutions. For us as dentists and for your business, what's one of those small solutions? Like I said, email the ADA, OSHA, and the CDC, asking them what are they doing about the PPE for dentists. If they drag their feet on this, guys, we're going to be closed longer, and it's going to be a problem. To me, that is the only question dentistry needs to answer right now. How do we reopen our offices safely? How do they tell us it's okay to go back to work? Right now, guys, they're telling us not to do elective procedures and do all these things because we're doing our social distancing. But when they remove social distancing or relax social distancing and open up restaurants and bars and movie theaters, will the NBA come back? I don't know. But when they do that, what are they going to do about dental offices? That is our top of mind scenario. So I want to say one thing here on my notes, that I appreciate all the interaction on Dental Nachos. I want people to be cautious with the emotional language. Telling someone that they're spreading fear can sometimes be responsible concern. So if you said, I told my neighbor not to go out as much as they used to because they're 70, that's not spreading fear, that's spreading responsible concern. So I just want to be careful of the words that we use. Fear, hysteria, we don't know. There's so many links going around. I just want to share with you, just like root canals and implants right now, we can find 10 links to share that this is going to blow up the number of cases and be a massive problem. You can also find links saying it's no big deal. It's got to be in the middle. We have to find this middle. We have to allow it to be in the middle mentally for us. I got people telling me it's no big deal. I got to tell people to hide in their basement. It's got to be somewhere in the middle. But I'm sharing with you as a person right now, and my friend Joe Latinelli shared a statement from a hospital director in New York. They're very concerned they're going to be overrun, run out of ventilators, run out of beds to take care of sick people. So for people who will say it's the flu kills people, what about the people that are nursed back to health? What if we have too many of these people and we can't get them back to health? I want to live in a society where we care more about sick people than money first. Money can come later. It's important. The economy, it's going to be painful. But if we don't solve caring about the hospital workers on the front line, our PPE drives, Mary, if you want to come here and say anything about it, you can. Our PPE drives, we're not going to even be able to fix the economy. I myself feel confident and comfortable that I will work hard on the recovery personally, dentally, try my best, but we're not going to have any chance for economic recovery if we do not keep the people of our country and earth safe first. So I'll be back on for a few more minutes, but Mary has an announcement about our PPE drive.
Hey guys, thanks to all the dentists who've been reaching out and letting me know about their drop-off locations. I just wanted to share a few. We have Dr. Todd Fleischman and Jessica Stubner collecting PPE donations in Center City. We have Michael Wong, who has 5 locations in Montgomery County. He has locations in Harleysville, Quakertown, Doylestown, Upper Moreland, Willow Grove. We have Jody Gilman, who's a nurse at Penn, who's taking donations at our house in Wynwood. We have Nipa Thacker, who's doing pickups and drop-offs in Chester County. We have Baljeet Kara, who's helping to coordinate with dental students in New York, Michigan, Ohio, and North Carolina. We have Maggie Augustine in Chicago. We have Lisa Campagna, who's sharing about Henry Ford Hospital in Detroit. Continue to email me if you have more drop-off locations that you're either starting yourself or you're aware of, and I'll add them to our growing list. And let's just all spread the word to our fellow dentists that this is something we can do to help our friends at the hospitals. Thanks, guys.
Thanks, Mary. That's awesome. You guys are working on that. We can, any small thing we do to make this better will be awesome. So I'll stay on for a few more minutes. I just want to do like 30 minutes here. A couple other themes that I had. Amanda, before I go over my last themes, any other questions that we have on the Zoom chat or Facebook?
Somebody asked, how can we work together to establish a proper infectious disease protocol and stay ahead of the curve? If
Awesome. We have an awesome Nacho. Hopefully he's on here. Rudy, who's trying to get this going. I think we have to really, really be loud about it and say, what are we going to do? We're here to help you, Ocean CDC. This is how we do now. This is what we do now. What do we need to do? What's going on with this COVID virus? How is it transmitted? Here's one thing. This is me just sharing as a person. I'm in this together with you guys. If you sneeze on someone and they're this size droplets, is that different than the aerosol that we create? Are those different size droplets? I'm very concerned though about how do we keep the next room safe for a patient who was in there before, maybe a 25-year-old asymptomatic carrier to a 75-year-old who has it. So this is something we have to be super, super aware of. And how do we do it? We got to get really interested in something we're very little interested in. PPE, gloves, masks, transmission. We solved the bloodborne thing with HIV and AIDS, and it's going to be up to dentistry. This is the biggest battle dentistry, in my opinion, has ever faced with PPE and OSHA. How do we get our offices open safely again? Really great question. I appreciate that there. Any other questions there, Amanda?
That's it for now.
Okay, perfect. So my theme before we go here. What is my one COVID drink of the day? Is anyone interested? So every day, I think you should just have one drink, but no one has to say how big that drink is. So today, my drink is the White Walker Scotch that my associates brought for me. We are facing these invisible White Walkers, and the theme of this is let's be patient and let's be concerned about the people on the front line. In Game of Thrones, the White Walkers multiplied in numbers. They became very, very, especially in the last season, huge numbers. And the only way to stop them, I won't ruin the ending, was not a way that we can deal with a virus. Okay, so if you're a Game of Thrones fan, you know what I'm talking about. We can't stop the White Walker COVID the same way they want to stop the White Walkers in Game of Thrones. So we're going to have to go with stopping the spread, decreasing the stress on our hospital system, and we can stay home and be heroes in our sweatpants for the time being and just wait. Just be patient. We've been in this for 7 days. I'm interested to see what happens in the next 7 days. Are we stopping the spread? But you're going to see the cases go up because there's people infected now who don't know they're infected, and I've read that April 6th could be the peak of this entire thing. So this is something critical for us to do. That is my White Walker one drink of the day. I want to say safety strategies and small solutions. We just ran a CE on TV on social media. Now is the time, small solutions. If you don't have an Instagram account, make one. We have tons of content. Some's complimentary, some is very discounted. Amanda can share it. We just did one with the awesome Dr. Desiree Yazdan, where you can connect with your patients on social media. What could you do? Facebook page, Instagram page. How do you connect with them? So someone on that webinar said, my social media company is sending out these generic things and it's not the right time. Yeah, it's not the right time. Calling the moment. So maybe you guys can all use this, okay? Because I want to do this for my team. How about this? How about a funny video of you in your sweatpants? Just take the video, whether you use it or not. Maybe I'm with the moderator who's 2, and I'm trying to get her to brush her teeth. And then maybe you say something like, do you have a lot of downtime? I have a lot of downtime. Can you find the time to floss once a day? This is your message from Dr. Paul Goodman. That's funny, 20 seconds. You're calling the moment. You're saying there's always in this time, you have to have fun, be normal, and make some jokes. One of my jokes the other day, I'm glad I'm not going out to a restaurant. I don't want to put pressure on the server to tell me which wine pairs with the end of the earth. That's a funny joke. I know it also sounds kind of morbid, but it's just everybody laughing and relaxing. So I encourage you to get some social media training, make an Instagram account, make a Facebook page for your practice, work on emails, and connect with your patients. Don't overconnect, but make a funny video about brushing, or, hey, when you're home 23 hours a day, can you find time to floss more than once? That would be funny for a patient to hear. And I just kind of want to leave you guys with that dentists, we're really good at something. We're really good at something. What is it that we're really, 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 really good at? Yeah, we're like professionals, probably the best in the country. I don't know. I don't think there's anyone else. I mean, teachers might say it, but they get some more downtime than us. So we are professionals at being annoyed. This is us on the inside part of our body. We went to dental school. Bring up that resiliency. All of us were in dental school and had some instructor walk by and be like, your online prep sucks. You're like, this is my first day in GRD. Like, it still sucks. We are used to being resilient. We had to sit there, and while our friends were doing things after college, like having fun and going to brunch, we were in a dark basement burning ourselves with wax, but we got through it. We were resilient. That takes a lot of resiliency. So you're gonna have to reach back to that resiliency from dental school and use it again. But I know we can do it. We're professionals at being annoyed. This is gonna be incredibly annoying to recover from this, but I know we can do it together. Take it day by day, take it hour by hour. Nothing's going to be solved by tomorrow. Don't watch the news 24 hours a day, but don't ignore it totally. And think how you can help. I encourage you, I kindly annoy you. If you haven't done anything yet, reach out to the ADA, reach out to the CDC, reach out to OSHA, contribute some PPE, call someone up and ask them how they're doing, because this is the time for us to be together. We're all in this together. As I jump off here, we have some cool things coming up at Dental Nachos. Every day, we're going to broadcast at least one CE on demand on TV. Tomorrow, we have the awesome Artie Volker and his ceramic, which ceramic to pick for the right situation. You're going to love it. Zirconia, feldspathic, right up your alley, guys. That's going to be tomorrow. We also have the $10 CE challenge. So I know my dental people. You're a very competitive people. You want to compete with each other. This person's crown prep sucks. That person doesn't even know what the Krebs cycle is. You don't know either. But you guys like competing with each other, but we're all at home. No one can compete with each other. So how about we compete with ourselves? So I have put together a menu. I love the menu of 16.5 hours of CE that you can rent for 14 days. I've made the price $10 so anyone can get it. $10, okay? Price of 2 fancy coffees. We can't even get our fancy coffees. Use your fancy coffee savings on this. So for $10, you get this 14 courses, 16.5 hours. If you take it all in 14 days, Amanda, who's here, will send you a $100 gift card to buy more on-demand CE to have for life. So that's 16.5 hours of CE that you get access to for 14 days. You do it all. You can do it in 1 day. You can do it in 2 days. Leave your family, go in the basement, do 16 hours of CE, whatever you would like to do. And Amanda will send you, just email amanda@dentalnachos.com with, I did the CE challenge and it must be super awesome to work for Paul. So I'll leave you guys with this. I'm thinking of you guys. We're going to do this every day. Check in with each other. Send us questions at salsa@dentalnachos.com. Anything else on your end, Amanda?
Nope, that's it.
All right, cool. End the Facebook Live, but leave the Zoom chat up for a couple seconds. And I'm
Okay.
going to say something. All right, perfect. All right, Dental Nachos crew, enjoy the weirdest Sunday ever. Curbs on later. I'm looking forward to watching that.
Okay, you're off Facebook Live.
Cool. People here on Zoom with us. Maggie's and Rudy. Oh, awesome. Yeah, Rudy, share what we, Rudy, how would people contact you if they want to contact you directly about this? So Amanda, Rudy is really into this, like I am, the PP, wants to get some people together on this, thinking about it. Yeah, I mean, you share with us and then Amanda will put that on the Facebook Live. Email Rudy to give your thoughts, to share. I think this is the key to getting us back to our offices. Just throw that in chat. Abby, thanks for being here with us as always. Cool. Oh, yeah. That's awesome. Yeah. Just give your personal email. I really appreciate that. That's the whole thing to me is getting back to our office safely. Nothing's going to happen. They're going to open up restaurants. They're going to open up gyms. They're not going to open up dental offices unless there's a really good answer for how to keep people safe. And it's an important answer. It's an important answer. If you think about it, as a dentist, you think I want to be open, but think about your own family members who come to your offices, your 70-year-old uncles, things like that. They come to my office. So how can we get open safely? All right, great. Perfect. You can email to Amanda Dental Nachos. Abby, Maggie, you're awesome. Rudy, Abby, everyone else here, thanks so much. And we'll see you guys tomorrow. Yeah, hugs to you guys. Virtual hugs and nachos. Have a great day, guys.